Welcome to Wellness Online Orientation.
Online health and dental consultation, online dissemination of health information, links with the DOH programs, referral to family's physician and specialist for proper treatment.
Our wellness team, headed by Ms. Choi F. Calon, Ms. Rachel Jude O. Espina, Junior High School College School Nurse, Ms. Anne-Marie C. De Leon, Elementary School Nurse, and yours truly, Ms. Heidi Grace L. Gonzalo, your Senior High School Nurse.
Our medical team,
School Physician, Dr. Edwina Cabato. Our School Dentist, Dr. Eileen De Leon. With Dental Aid, Ms. Chema Ortiz.
Our objectives is to ensure the continuity of Icas healthcare services amidst of the challenges of COVID-19, to maximize the learning opportunities of Icas students by raising health awareness through integrated distance learning, to incorporate day-to-day health habits.
Other programs offered: health services, yearly fumigation, canteen inspection, mental and emotional health, referral to the guidance office, health information and instruction, student empowerment, health service extension, by training students and first aiders, the basics of first aid and basic life support. Link with the City Health Office. Implement minimal health standard guidelines issued by DOH.
Here's a brief about COVID-19.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China.
Here are the mode of transmissions.
Transmission occurs when respiratory droplets produced when an infected person coughs or sneezes are inhaled by a person nearby. Contact transmission occurs when a person touches a contaminated surface and then their mouth, nose, or eyes. Aerosol transmission occurs when respiratory droplets containing the virus mix into the air and are then inhaled. COVID-19 is stable for up to 24 hours on cardboard, 2 to 3 days on plastic and stainless steel, and up to 3 hours in aerosols, which include fog, mist, dust, air pollutants, and smoke. Therefore, it is possible to get infected by touching contaminated objects or through the air.
These are the signs and symptoms of the COVID-19.
Well, from what is known so far, there can be a number of symptoms ranging from mild to severe.
Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting, or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19, according to the final report of the initial outbreak conducted by the Joint Mission of China and WHO. Day 7. The patients that haven't started recovering by Day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease and are discharged from the hospital.
These are the safety tips and precautionary measures.
These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider.
Buenos dias to everybody. Good morning to all. Maayong buntag para sa tanan. Here in Icas, I would like to explain that to all of us, parents, teachers, non-teaching staff, our co-workers, support group, and most especially to our students, we'll be assuring that everyone here in Icas will be in safety and also in good health. And that's the reason why we follow closely the mandates of our health office in the city and the nation, and also the LGU mandate regarding COVID-19 precautionary measures like protocols, so that we will always live here as one family regardless of what would happen outside, that we can say we're all secure. So much so that we will always say our students are here, our priority. And that's the reason why for all the parents, we always allow you to feel that we are part of one family, one home, one community here in Icas. So we belong to one family, and that's why we care for one another, as Icas would say with our hashtag I care and share. And because of that, we have no worry. Everybody is welcome as we start the new school year 2020-21. We assure you of what we can do for Icas, the betterment not just of education, but for the good of all, especially for your children, our students. Muchas gracias.
We are your wellness team.